Time now for this week's Health Matters. I've got Lynn Szabo here at the microphone, and along with Mike Thornton. This week we're talking about vaccine mandates. Oh, vaccine mandates, right?
Yeah.
That's his
politically hot topic to the rational person, not such a big deal.
Okay, yeah. Where's that line drawn here? Where's the line between rational and irrational?
I don't know. It's hard to say these days.
So I guess for me, just with mandates, thinking about the various quote unquote mandates, from the beginning of the pandemic, I've been confused about just how enforceable things like this were, from public health officers, from the governor. Yeah, it all seemed like in the final analysis, you could have a mandate, you could have a guideline, but people are just going to do what they're going to do anyway. How much force do these mandates have?
Well, they have a supporting Supreme Court decision, the United States Supreme Court from the flu epidemic, so in the early 1900s. But I think that in order to do stuff you want to do, you have to get vaccinated. That's the best way to look at a mandate. It's not just, like a dictum from on high that you have to get vaccinated. It's like if your kid wants to go to school, your kid has to be vaccinated. If you want to fly on a plane, you have to be vaccinated. If you want to go to a concert, you have to be vaccinated. So I think it's more than just somebody saying you have to do it. I think the consequence is, are you going to be able to do what you want to do if you aren't?
New York City actually has one of the most strict mandates in the country, and my understanding is that they're enforcing it quite strongly.
Really, with fines, with penalties?
Yeah, you basically can't do anything in New York City unless you're vaccinated, and there's no testing regimen that I know of either. It's just straight up, you have to be vaccinated.
Right. Mm-hmm. So in order to get where you want to be, you have to get the shot.
Restaurants,
so you
theaters.
Can't really force an individual to get a vaccine, but you can force them to be vaccinated if they want to do something like go to work.
Or go to a restaurant.
Yeah.
Well, yeah, but then, okay, so what's the political debate then? I mean,
I think it's largely misunderstood, and I think the political spin is to somebody's benefit and against the kind of the truth.
Okay, and then what's that truth?
The truth is you can't force somebody to be vaccinated, but you can keep them from doing what they want if they're not vaccinated.
Yeah, okay, I see what you're saying. The difference between, yeah.
Well, I mean, and in many ways, it's whatever jurisdiction is doing it, how willing are they to actually enforce it? I mean, I heard a debate on CNN earlier on Sunday with the mayor of New York and the governor of Arkansas. And the mayor of New York, Bill de Blasio, this is what we're doing. We're going to enforce it, and we're serious about it. And the governor of Arkansas is going, vaccines are a good thing, but, we should try to educate. We should try to encourage. And one of the main differences, at least that I heard, New York, the fully vaccinated rate is 70+%. In Arkansas, it's like 40 or 50s.
Yeah.
That. And so that was sort of okay, you're saying you can't mandate, but look at where your vaccination rates are, and here they're mandating, and look where their vaccination rates are.
Yeah, so much for the education and informing of the populace.
Right, because it's not being effective. It's like what's happening here in Del Norte. I mean, there's been a lot of informing. There's been a lot, maybe not a lot of encouraging, but, and, we're at 51%.
Yeah, peg there. It's been a while. Yeah.
Right. So I think there's also ways to opt out of it too, and that's not really brought forward. So an employee that really doesn't want to be vaccinated, or maybe has a legitimate medical reason not to be vaccinated, can get weekly testing. It's not a big deal. It's really not a big deal.
Right. And that's, going back to the beginning of testing in the pandemic.
Yeah, healthcare providers in the beginning used to get tested every week, kind of mandatory. all staff in the UHS system got tested. I think UHS, that was probably the main reason they got testing equipment available so early.
Oh, wow. Okay.
Yeah. And they dove right into it. But that kind of petered out. And it petered out because the amount of virus in the community dropped off. Okay. So the part of this discussion ought to be this pandemic is kind of waxing and waning, and in different circumstances, response could possibly be different, but government never really moves that fast.
No.
So, and it also could be a little different in a rural area versus a highly urban area, as far as risk goes. But again, that's something that you're going to know like in 6 months. We should have done this.
Right.
Looking back.
Yeah.
And that makes it really, really hard to argue, I think. So it seems like it's a better idea just to set a rule down and enforce it.
I question our collective will to enforce those rules, and that goes all the way back. Okay, so the Redwood Voice Youth Media team spent a week trying to get information off the internet and making phone calls to make a PSA that was just basically a laundry list of all the places you could go and be vaccinated.
It was nicely done, by the way.
Well, thank you very much. It took a lot of work and
check it out on YouTube.
Too much work it took, because there we found conflicting pieces of information. We found just straight up wrong information being shared, and this goes to, I think, the heart of for me, the biggest hole in our society that's been sort of exposed by the pandemic is that we don't have, and it's going to sound like I'm lobbying for like what do they call him, a tyrant, right, to come in, some dictator to come in. We don't have any one place that's calling the shots, and I think that, as with all corporate bodies, a lot of things are going to fall through the holes in the net, because there are people who just aren't. There's nobody responsible for bringing together everything. So if we can't even educate effectively, how are we going to enforce a mandate?
Well, I think the function of that, at least, or that role in this county, would be the public health officer. And there's a network of public health officers, and I suppose the CDC is part of it too, and probably the Surgeon General. But again, that's not responsive enough for, what's going on in a particular moment of time. That's always been the problem here. That's where, Fauci says masks are not going to do anything, and then all of a sudden masks are important. It's because things change in time, and they change with our understanding, and our understanding changes with the variant of concern that we're working with.
Sure.
So it's really, really difficult. But, there exists OSHA. So workplace safety is a thing. Right.
And wasn't it through the federal level OSHA? That was how Biden's mandate was going to work.
Right. That's been rolled back.
Right.
That's kind of looks now like that's not even going to happen.
So that's disappointing.
Yeah.
Because that system does exist, and it's supposed to keep people safe at work. That's the whole point. And so if they're choosing not to use that, then that's something that was nationwide.
One of the things that I often think about is, why did we even go with this? Well, there can be a testing alternative, right? I mean, I understand that there are some groups of people who physically can't take these vaccines.
Just as there's some groups of people who can't take the swab up the nose too, right?
Well, I mean,
why is that?
I don't know.
There's I can't think
deviated septum. I have no idea.
No.
I just assume there'd be people. I can't take this test.
No.
Even religious.
No.
I have a religious
First church of the nose.
prohibition of having something shoved in my nose. No, but I mean, like with most vaccines, I mean, I believe there are always a group of people who can't take them for whatever reason, and so there has to be a way to deal with that. But at the same time, it's like, so we're going through all of this thing about, well, testing versus vaccine, and I mean, but there's all kinds of mandatory vaccinations for kids who have to go to school.
Oh, totally.
Yeah.
This is
And like, you know, it's not like,
right.
there's no like testing alternative for like whooping cough, right? I mean, you're either vaccinated against it or you're not. I mean, and that might be too specific, but in general, all of these mandated vaccines, it's not like there's a testing alternative for
Right,
them.
but there's no pandemic of whooping cough right now.
Well, maybe that's
pandemic
because people have been mandated
Yeah,
to be
because they've been
vaccinated,
vaccinated,
against
go
them for,
figure.
60, 70 years.
Yeah, but we did have that 2010. We had an epidemic of pertussis, which is the official name of whooping cough in this county.
We had one in Nevada County where I was.
Oh yeah, that was widespread at the time. Yeah, yeah,
Right.
and born on a lot of the shoulders of poverty and rural America too, right?
Well, at least in the community I was in, it was actually more kind of affluent,
Really?
hippie parents.
Seriously?
Yeah. Oh, yeah. Yeah.
Picking it up at the
absolutely.
Montessori school or something? What was
Well,
it?
no, literally, my granddaughter went to a school. It wasn't a Waldorf school, but it was kind of Waldorfian.
Sure.
And we had a pertussis outbreak there.
Wow.
And it was centered in a lot of reasonably affluent families who, back to nature. We don't believe in
Right.
vaccines,
Oh,
kind of
okay,
thing like that.
okay.
I mean, the CDC actually sent someone out to go, what the hell's going on here?
Wow.
And that's how a lot of that came to
Right.
light.
Oh,
Yeah. Yeah, our 2010 thing, actually, patient zero was found in the old Sutter walk-in clinic by Clonnie Baker, who was a PA working at that time. And that infant was came from out of the area and was unvaccinated because the infant was too young. But I think when they figured it out, I was probably vaccinated within 6 hours after they figured it out. And it was like Sutter sent over the vaccination nurse, and it just happened. Nobody asked me my opinion about it. Of course, I was glad to protect my patients.
Sure.
But there was only a limited number of doses, and it was interesting to me that they all immediately went out to the providers, kind of mandated. So I think that goes back to the Supreme Court decision from 1905, 7-2 decision based on the idea that an individual's right to liberty stops at community health.
Wow. That's already been decided.
So there it is there. Right. And
Yeah, but the Supreme Court says a lot of things.
yeah, and our Supreme Court is one for overthrowing precedent and without serious thought. So, I don't know if that's going to be rechallenged, but I doubt it'll happen quickly.
Wow.
So, but what it boils down to is everybody has some restraints in their life for the common good. And this is not an unsafe vaccine that we're talking about. This is certainly an unsafe virus. This particular virus of concern is kind of hard to find at testing. So even the weekly testing thing is a little sketchy for Omicron in particular.
Oh, wow.
Yeah.
It's just that different. It doesn't show up in the test.
It doesn't show up very well in the screening tests, but it shows up with a unique pattern in the more complex DNA testing. So, exemptions only exist to have compliance with the Americans with Disabilities Act. So if the ADA, this is one way that you could argue that the ADA is not being super helpful.
Right.
Yeah. So. And religious exemptions have to be well rooted in something that's defendable. You can't be. What is that spaghetti religion? Do you know about?
Oh, the
this?
flying spaghetti monster.
Yeah.
Yes.
Okay. So I wonder what their their religious view.
It's a slippery slope.
Vaccines is. Yeah. You can't really do a free float on this one. So.
Well,
yeah.
one of the things that I found really interesting is that the Del Norte Unified School District Board of Trustees did one of these let's send a letter to the governor thing. But one of the things that they did is they advocated for religious exemption when it came to getting vaccinated for COVID. And I'm still struck with, why is a public entity, a taxpayer-funded government entity, advocating for religious exemption? I don't think they should be opposing religious exemption either. I don't think that they should be taking a position on it.
They should be separate from religious exemption.
Right.
Well, yeah. I mean, they weren't advocating religious exemption for the city, right? They were advocating for the citizens, like individual religious exemptions.
Yes.
Right.
And I guess my point is, I don't understand why a governmental entity should be advocating for or opposing religious exemption when it comes to anything.
Well, exactly. Yeah. No, I agree with you. It's the same. I don't understand why a governmental entity would take the time out of their elected time to write something that is clearly beyond the purview of the duties to which they were elected. Right. I mean, that's
Really, and not
what I come back to.
representative. I think I think you could argue that there's I don't know if it's the majority of the community, but there's a certain portion, probably pretty large, of the community who thinks that's rubbish.
Yeah.
Yeah, they didn't come and talk to me about it.
Nope.
They probably didn't talk to the public health officer.
And for the city, it was our illustrious mayor who was behind all of that. You know what he does for a day job?
Wow.
He's a CO.
Really?
Yeah.
So there's a bit of a conflict of interest.
A little
there
bit there. But he's also, I mean, a conflict of interest. We've talked about this on the air. How is that a conflict of interest and not just, him living his life?
Well, I think because if I remember correctly, he specifically singled out the situation with prison guards when it came to the need to do this letter. And it seems to me that it would have been appropriate for him to say, and yes, just in full transparency, I too am part of this group that I'm advocating on behalf of.
He's not advocating on behalf of them, right? He's using them as an example of the resistance in the community.
Well, but the prison guards and their union are specific opponents
to
vaccine mandates.
Yes.
So they're not just a collection of individuals. I mean, this is a political entity in and of itself that is arguing against these mandates. And I don't know. I'm not a conflict of interest
Why is it
lawyer.
a problem for him to get tested once a week?
Yeah, I don't know. They don't even bother to get around
It makes
to that.
their eyes water and they cry. I don't know. I mean, I don't know that you can. I would argue you can't have it 100% your way if it's going to harm other people. And I think the weekly testing is not an unreasonable thing to do.
Particularly when you have a captive audience of people who do not have the ability to take appropriate measures to protect themselves against the spread of disease.
Right.
There's and vaccination rates in the population of the prison are much higher than they are just among the general population in Del Norte. I have met a couple of guys who haven't. I've known a couple of guys who haven't been for political reasons, who didn't want to be. African American inmate who just would say Tuskegee. He's not taking anything.
Sure.
Right. And I can understand that to a point. At the same time, you're living inside. You are fish in a barrel. And it's best to be vaccinated. It seems the overwhelming majority of the inmates are vaccinated, but it's only about half among the if even that, I guess, among the staff out there. And it's fun because it has been a labor issue because of the CCPOA, and I'll also just sure, let's do this. I went out to do a class this week. Was told that there was a count going on, a hard count, and so there were no programs being run in the yard where I was supposed to be that day. And get a call the next day from one of my students, an inmate, who says there wasn't a count. It was a work slowdown because the CCPOA wanted to make a point because The next round of appeals for about Governor Newsom's, or rather the state's mandate, for prison staff workers being vaccinated, that Newsom doesn't back now because of the CCPOA. The next round of court appeals opening arguments are set for, as we record this, tomorrow.
Right.
So they were just kind of dragging their feet through a shift. Yeah.
Well,
yeah.
and that
just
shows,
letting it be known.
and that shows another problem with this whole way these mandates are put forward and or enforced. Because on the one hand, Governor Newsom has been pushing really hard for mandates in other areas like schools and just in general for communities and all of that. But then we have this one politically powerful entity that says, well, we don't like that. And he's like siding with them.
Because they're so powerful.
Because they're so powerful. And it's like, well, then, okay, what happens with all of this follow the science? I mean, why are we following the science when it comes to kids? And I'm not saying we shouldn't do that, but we're following the science there. But over here, we're not following the science. We're following the politics.
I think that is the biggest problem with all of this, because it makes the powers that be, it shows them to be little more than special interests in the right situation, right? There's their interest being their own continuation of their power. So when you have, like, say, the governor of California, who's been very, very, I think on the good side for most of the pandemic, turn around and do something like that and kind of vitiate his own stance, it undercuts his own authority. I think in the future, anything that he says or that state government says is going to be undercut, because we've all known, well, yeah, sure, you're right and you're doing the right thing for public health, but you now, in this instance, you're not. You're doing it because of power. So that's going to undercut all your messages.
Well, I think it undercuts almost all of everybody's messages.
I need to take this. This is a prison call.
Okay.
I don't know if you guys want to pause.
Sure.
Or
Yeah,
what.
What you got to do.
Okay, thank you. Okay, where were we?
Well, I was at the end of my notes.
Yeah, I think
was to the point where I was going to say, just do it.
Yeah, I think what I remember where we were just talking about how, like, people like Newsom, when they enforce mandates on one hand and then not on the other, how that undercuts the entire message.
Yeah,
That's where we were at.
Yeah, okay.
I think we could wonder what they did, what Newsom's office did with that letter.
Yeah, I guess.
I bet I know.
So the city writes its letter at the behest of our mayor, and with the complicity of our mayor pro tem, the disappointing complicity, and they send it off saying that Crescent City isn't down with vaccine mandates and mask mandates too. I think that was part of it, wasn't it?
Yeah, certainly vaccine mandates,
Yeah.
And then once again, I mean, I don't remember the wording of the actual letter, but I do remember that the argument in part was, well, what about our prison guards and what about our healthcare workers? And so because they might not want to do this, therefore it should be opposed.
Right. And this is after, I think they even mentioned specifically the protest of the healthcare workers outside of Sutter, right? Back when there was that first initial with the vaccine mandates for healthcare workers.
I think that's so weird that was expanded to think that all healthcare workers.
Well, and that's the problem I have with the city's
I think
letter.
that was a couple of nurses.
Right.
No diss to nurses. I'm honored to work with the best in the bunch, but I don't think was there a physician involved there, or was there?
I don't know. The people who were out protesting were the usual suspects, right? You drove by out
there.
Yeah,
they were the usual suspects. The Ion Del Norte crew and all of that. But I mean, another thing that happened after the letter. Karen Harner of Del Norte County
local news and events
did a thing where she put together a letter saying, well, wait a minute, there are people in this community.
Right, I signed
and
that.
well over 100 people asked to sign on to that.
Right.
And that was far more than the people that the Crescent City Council heard from
Right.
or acknowledged hearing.
Yeah, and I think her main point was she did not appreciate having her voice taken away from her. Essentially, they did that. They didn't have any support in the community, as far as I could tell, beyond the groups that they kind of outlined, and who knows really what the truth in that was.
Right.
So,
Well, once again, I mean, it was the usual suspects.
Right.
And, I mean, pretty much everyone in this community knows who those folks are.
And that's ultimately the problem I have with the city writing that letter is who are you elected to represent? Are
Right.
you here to represent this vocal fringe, or are you here to represent all of Crescent City?
Right.
51% of whom have been vaccinated. So
Right.
what's your job?
that was an
ultimately?
ego move. And what
Yeah.
do you think happened to it when it hit the governor's office?
The letter? I don't know. What do you think?
I have a file.
I think it went on it went on a refrigerator somewhere. But what do you what do you think happened to it?
Like they threw darts at it. I think it was read and set aside and ignored.
I know exactly what happened to it. They used it to wrap the leftover étouffée from the French Laundry.
I think that's right. It was for you can see Gavin Newsom sitting in the French Laundry pulling it out. Get this, reading it to his fancy friends.
And then somebody, and I don't know how you say it in French, but somebody said, "Do you need a la doggy bag?" And he said, "No, I happen to have something right here." Thank you
I'm
very
sure that
much."
it was looked at with kind of a dim eye, and probably only got a second worth of consideration, if even that.
Yeah.
So,
That's too much.
yeah, because have we heard any feedback about
No.
their letter?
No. It just went someplace and sat.
Well, that's interesting.
It was just one of the things, and I just sort of remember the general conversation. Mayor Greeno had recently been at some sort of right-wing meeting, and Roger Gitlin, who was also apparently at this same right-wing meeting, they were pushing for this because this was the position of the political interests that they represent and serve. And so
Right.
that's
So
why,
it was
that's why it had to be done, without any real outreach or surveys
or thought
or-
process. Yeah.
yeah. So
Right,
they
it was
just
an
it
ego
had to
move.
happen right away.
Ego move. Yeah. Okay.
Yeah.
All right. But I think the solution to mandates is just get your vaccination. Just do what you need to do to care about your community, to make sure that we don't need the refrigerated truck behind Weir's mortuary, that we don't lose any more people. And it's really not about your personal and not about your ego, but more about the community. That's my last thought.
Yeah, and
There it
I'm
is
not
there.
sure what you need to do to bring that home to, the kid rocks out there who think that somehow being an American, being a part of the American community means that nobody can tell you what to do.
Well, but yes, and the Kid Rock thing that was probably his most downloaded song in the last 10 years, 15 years. I mean, it's a marketing thing too.
Right.
Yeah.
Do you think he really he jams through every stop sign?
Yeah.
I mean, like,
that's
really.
why it doesn't make sense if you
Right.
just the barest amount of thought. And I don't know. All this is why I've come through the pandemic with even less of any sort of faith in humanity, just to have the right thing laid out right in front of you, and to still not be able to do it. But maybe that's everybody's failing. I don't know.
Yeah, no, and I think it's sort of, it's increasing, I think, the understanding and need that people have to do the right thing for themselves and the people that they care about, and the people who they're around and care for. Because the ability to do these sweeping public health kinds of things, which existed at one point in this nation just don't seem to exist that anymore.
Yeah.
I mean, almost everybody has gotten this whole series of vaccinations when they were kids. And, there weren't like super widespread demonstrations about them.
He just went to school one day and they did it
And
at
they
school.
did it.
They did it at school.
And anybody who's been in the military has had to have the same thing.
Oh, yeah. Yeah, when I was immunizing elders for UHS, all the older men talked about how they got lined up and boom, boom, boom.
Right.
And they didn't even know what they got immunized for.
Right.
They weren't even allowed
You
to
do
ask
this, and they went,
questions.
okay.
But on the other hand, somebody gets an ability to go to Thailand, and they line up for their shots.
Sure, right. I first time I went to Central America, I needed
Right.
to get a series of vaccinations.
Right. Step on a nail out in your chicken coop. Boom. Tetanus shot. This really isn't so different. This isn't new technology. We've talked about this before. Yeah. And right now there's probably billions of people who've been immunized on the planet.
Right.
Then there is nothing to be afraid of.
Yeah, and that's specifically, I mean, just in general, but specifically for the mRNA vaccines, which are opening up a whole, wide new vistas of possibilities for vaccinations.
This is something to celebrate. And we could mention again that if you got J&J and you've only got one shot, you need the second shot. This shocks people. It still message hasn't gotten out.
You need the second. Well, what surprises them? What surprised me was the after all the initial glowing reports of J&J vaccine that it's only like 2 months is all you get.
Right. Right.
I just don't mean to laugh.
And what you really need is an upgrade. You need an upgrade to messenger RNA. Mm-hmm. So the messenger RNA, what we know from looking back 6 months is that the messenger RNA is going to be the gold standard here.
All right. Well, we'll keep doing what we can to get vaccinations at arms and get the messaging out there. And I assume you'll be doing the same, PA Lynn Szabo.
Yep.
Anything else?
Nope. Maybe next week I was going to talk about, again, because I've talked about it before, but the doctor's secrets. So what healthcare providers do to stay healthy?
Oh.
Well, they get immunized.
A look behind the stethoscope.
Right. But what else do we do?
Yeah, because there are some other things that you've mentioned that
might
could be prophylactic.
helpful.
Cool. All right. It is Health Matters. It happens only right here on KFUG Community Radio.